A blessed good night, a blessed new year to one and all. My name is Ramon Goodman. I'm your host for tonight. This is Dlp TV. This is my TV. This is your TV. This is the people's TV. Honest voices for the people. Tonight, we have a full cast. We will be having a conversation surrounding health and wellness. To my left, we have Dr. Hinds, Roleric Hinds. Pleasure tonight. Pleasure seeing you tonight.
Good to see you. Pleasure being here.
Yes, please. Candidate 2018 and also 2022. Thank you. Pleasure being here. Then right next beside me actually, it is Senator Worrell. He is the spokesperson for health and president of the Democratic Labour Party. To my right is Dr. Wickham. Pleasure having you.
Pleasure to be here.
Yes, please, thank you. He is a general practitioner.
Yes,
That's
please.
correct. Pleasure. And to my right, it is the Pan-Africanist and socialist, David Denny. Pleasure having you here as well. Absolute pleasure. We have a hard-hitting show here tonight, and we are going to get this thing rolling and on the ball. I'm going to start with Senator Worrell. Now, we might need 5 shows to really encapsulate the challenges that the people when patients go into the hospital, the challenge that they face. But I just want some insight from you, where the challenges are concerned.
All right, thank you, Ramon, and welcome to all those persons watching online, Dlp TV. And it is a pleasure for me to be here, and our first show for 2025. So I want to wish everybody a happy new year and God's blessing. Now, tonight's show, we want to focus on health and wellness, as you've said, and especially at a time like this where people normally make their New Year resolutions. And part of those New Year resolutions would be to go to the gym, to exercise, or to have a proper diet. So those are the things that we want to focus on. But before we actually get into that, we have to show a little concern for the situation currently within Barbados, where a lot of people are concerned about the health sector and the actual ability to get proper care at the Queen Elizabeth Hospital. Now, I don't think that all of it is necessarily the fault of the Queen Elizabeth Hospital, but they normally be the ones taking the majority of the blame, and we don't focus enough attention on our polyclinics and our primary care setting, which unfortunately is no better than the Queen Elizabeth Hospital, because I don't think that they're necessarily getting the resources. And you find that a number of persons in Barbados are waiting to a very late stage to actually go to their doctors, their GPs. We have 2 general practitioners here with us tonight, and I'm certain that they will tell you that in their clinics, they're recognizing, well, persons are not necessarily coming to time that they would want them to. And then there are issues with adherence to medication. There are also issues with adherence to diets and even exercise programs and all of the things that would help to make them well. But looking at our polyclinic setting, you know that for years in Barbados, going to a polyclinic, people always say it as a poor man's thing to do. But more people are actually using the polyclinics in Barbados. And I think that we need to get away from that mindset that the polyclinic is the poor man's thing to do and see it as the first access to proper health care. And therefore, the polyclinic system in Barbados needs to have all of the resources so that when you go to the polyclinic, you shouldn't have to refer them to radiology for an x-ray. Those are things that you should be able to do there the same time, which would help in the diagnostic process. You shouldn't have to send them to the reference lab for simple tests. You should be able to do simple blood testing within the polyclinics as well, which would take a lot of the burden off of the Queen Elizabeth Hospital, and it will help the doctors in the polyclinic setting to identify some of the health issues that persons are coming in there with. We have a lovely polyclinic setting for years, which you have public health nurses who can actually go out into the community with persons who might need help with their diet or exercise or changing dressings, that can do all of these things. But I find that they're not being efficiently and effectively utilized now. And we face a situation where persons are staying at home and suffering in silence because they don't want to have to waste the time to go to the polyclinic and do the runaround game from here to there to there. It's almost like you're pushing draft checkers on a board. And we need to enhance and upgrade our delivery of healthcare services in Barbados to make it more accessible to people. And that is the focus that I would like to take tonight in terms of having this discussion on health and wellness.
Well, there are many complaints in terms of the treatment, just basic manners, from the nurses and so forth, from what I've been hearing. Any comments on that?
Well, I would say that generally our healthcare professionals are very professional, but obviously if you are overburdened on the staff, there may be a day that you come in that you may be a very loose, a short flare, a short fuse, right? But I would generally say that the majority of our healthcare workers are very professional and very caring, the nurses. But if you put them in a situation where you overstress and you overtax them, like any other person, you break down and you have a few breakdowns within the system. These are the things that we need to avoid.
Yes, definitely. So we have two GPs on the panel, obviously. So what are your thoughts in regards to, you're seeing an influx of people seeking private assistance, and influx?
I definitely see a number of persons coming into the office who will express frustration with various aspects of care in the polyclinic, some of what Andre would have mentioned. So definitely you see that. We may have a little more opportunity or a little more time to spend with the clients working through, because we don't see as many as in the polyclinic. I worked in the polyclinic system for 14 years, so I know how hectic it can get in there. And unfortunately, sometimes it became like a conveyor belt system, in, out, and not enough time to work through persons' various problems. We even had to, just before I left the system, we even had to increase the length of time between persons' appointment visits, which wasn't ideal. And you try to do it as safely as you could, but sometimes you put persons at 6 months appointment who ideally might still have benefited from a 5, 4, or even the more typical 3-month appointments. But the primary complaint that you get when persons come over is, not the time not seemingly being there for their various problems to be adequately worked through. It's more about getting them a prescription and on to the next person.
Okay. There was some talk, and there's a whole flare in terms of cardiovascular situation. It has to do with diet. It has to do with biology. What the whole surge is about.
Combination of factors. Definitely the high prevalence of the chronic non-communicable diseases in Barbados is a major part of that. Yes, family history also plays a role in that. If you have a particular family that has a higher than normal cholesterol level, which may be definitely genetic, then that particular family may, are likely to have higher incidence of heart attacks, strokes, and related cardiovascular diseases. But then the lifestyle aspect, that is to say, persons who are, maybe over their ideal weight, who have high blood pressure for various reasons. And there are a lot of reasons why a person's blood pressure may be high. But these chronic non-communicable diseases, diabetes, hypertension, high cholesterol levels, when they're not well controlled, over time, absolutely increase heart attack, stroke, and other cardiovascular diseases. So it's the lack of control on that. The point needs to be made that quite often these diseases are diagnosed late. At the point that we see the person in the office and they have met the diagnostic criteria to be called hypertensive, most of the time we are unaware for how long this person was hypertensive. they could have been hypertensive for 5, 10, or even 15 years before. And the implication of that being that that's time that the circulation throughout their body, what we call the circulation tree, has experienced some like irreversible changes. So even if we got really good blood pressure control now or blood sugar control now at this moment in 2025, we can't undo what happened for the last 10, 15 years. So early diagnosis is key.
Understood. Yes, thank you very much. Dr. Hinds, I know as time goes on, I'm seeing an influx of processed foods. Is there a correlation between obviously the chronic diabetes and hypertension and so forth, between all this the influx of processed food and those type of diseases? You're seeing an influx.
Well, yes, but the correlation between the foods you're talking about and diabetes and hypertension is that you have people tend to like salty foods somehow or the other, or they're either laced with sugar or they're laced with salt. Okay, and using these things over time, you're going to have problems with your blood pressure. You're going to have problems with your diabetes. The majority of patients we see are either hypertensive or diabetic. We are so busy with these two categories. It's difficult to deal with other things. People still suffer from other conditions like lupus and so on. But you can diagnose those. But we're overcrowded by diabetics and hypertensive. We do offer other solutions. We had when I was working at the polyclinic, we had a nutritionist twice a week on Tuesdays and Fridays. Just one nutritionist, and I think that was overbearing. I think you should have at least 5 nutritionists. You should be there every day, because if you get people coming in every day to receive nutritious advice, because the ministry has a unit, they do a lot of health promotion, but the thing is that's not disseminated to every polyclinic. If you only have twice a week, you're not getting that information out there. Because I see some of the health promotion posters they do, it looks good. But the problem is for persons to afford that type of food. You see some nice foods there. You see pumpkin, you see cassava, you see a whole range of foods. But for the average person to afford those foods, it's difficult, and for the ministry is doing a half a job. They're actually doing the health promotion, but I don't think it's disseminated to the wider population. And the government is not doing enough to make those foods available to the general population. So you will see an increase in chronic diseases, okay? Because let's say you go to the accident emergency, you're there with a relative, and the only food that's available is from a snack machine. And these snack machines are loaded with high salt and high sugar foods. Pack of tea times, high sugar. So they're not healthy foods available, right? We need to change that. We need to definitely change that.
You've mentioned schools. We have another special guest here, Mr. Alwyn Babb, and he would have done some coaching in schools. That is correct. Yes, please. Well, you mentioned nutrition in schools. I know when I was going to school, in terms of training, it was heavy on training with any type of sport. Is that still the case? Are you finding that the youngsters are a little unfit in these particular times?
Let me just clarify something. I'm within the school. I'm employed as a physical education teacher.
Okay.
So most of the times we get confused between the coach and the physical education teacher. The physical education teacher is responsible for giving the why and the how. The coach then takes that from the classroom and refines it into what we see on the track or what we see on the football field or cricket field. So I am a physical education teacher who has a passion for coaching.
Beautiful.
Right. Within our school setting, the physical education is not seen as a department. We're tacked on to any department that is at the whims and fancy of the management of the school. So what we're talking about here and talking and discussing among ourselves is about education. Where does education start? Within the school.
Right.
But then we're not talking about the problems that present themselves as adults who come into the public and external health care system. So we have to have a revamp of our education system. If we're talking about educational reform, it must define clearly for everybody and everyone to understand the difference between the physical education teacher and their role and the coach and their role. So that when we are presenting our information from our texts, we now see that the subject is now tested at CSET and CATE. So it is high time that we stop playing the lip service and we treat physical education as the core for developing a healthier nation.
Definitely. And I agree with that. I know that when I was going to school, in terms of physical education, especially CXCs and so forth, that was not a thing from what I can remember. So it's good that, that is starting to go forward in a serious way. So I know before, even in my time, which actually wasn't too far ago, there were a lot of people who would shy away, youngsters, able-bodied youngsters who would shy away from physical activity. You're finding an influx of that, or the levels are still the same?
I think because of we were let me just say that we were unfortunate to rebound from COVID in the region as one of the nations which took very long to recover from COVID. What we've experienced now are those first form, second formers who are now in the senior school and the sixth form who had their first exposure to secondary school as online because of COVID. And we found that because we were not in contact with them physically, that there is a reluctance on their part to become involved in physical activity. So therefore, it also resulted in some of the performances that we have seen in our sport. So we're hoping now that we're more or less a couple of years outside of COVID that we see that turnaround. But generally, boys tend to be more competitive, so you get a bigger number of boys. But as girls become older, they tend to shy away from physical activity.
Yes. Some of them go to the makeup and stuff.
They don't want to sweat.
They don't want to sweat.
They don't want to sweat out.
They don't want to sweat at all. Mr. Denny, yes, sir. Once again, a pleasure having you here. You have championed the cause for medical care in Cuba and Venezuela. Tell us a bit about that.
Well, let me start by saying that since 1998, I have organized for over 200 Barbadian students to study in Cuba. Beautiful. In the area of medicine. And a lot of them became specialized doctors and are now working all over the world because they were denied the opportunity to practice in Barbados. In fact, we have about 90 medical doctors in Jamaica that would have studied in Cuba, working in remote areas and countryside in Jamaica, and are doing a very good job and are helping the Jamaican community. The whole idea was to send our students to Cuba to study medicine and nursing so that they can come back and give back to the Barbadian community. That did not happen. There's only about 8 or 9 doctors over that 200 that are presently working in Barbados after doing the Caribbean Medical Council examination. And most of the doctors who went through the process in Jamaica and other countries to do that examination decided that it was better for them to remain there and work there because of the conditions and what they find and the way they were treated. And they decided to stay in Jamaica. You have to respect that. But some would have gone to first world countries and other Caribbean countries to work. The truth is that we need to seriously look at health care for poor working class people in Barbados. a lot of poor people cannot pay for healthcare because of the cost. And in the past, both governments, the government of Cuba and Barbados, set up a program for eye care for many Barbadian people to travel to Cuba for eye care. I honestly don't know why that program came to an end. But a number of Barbadian people benefited from that eye care program. And that program between Barbados and Cuba, they organize the international travel so that you can travel to Cuba for free. The accommodation and meals for 2 weeks. The operation costs and everything was organized by the governments of Barbados and Cuba. And then it was also assisted by the government of Venezuela, who paid for the medical care that Cuba was offering. I am an example of that care, not of that program, but I went to Cuba at a time when I could not see. When I told I cannot even drive my motor car. And the Cubans put me through a program, a diabetic program, where they look at my history from a child and then advise me how to take care of myself, how to doctor myself. So it was not only treatment, but they taught me how to take care of myself. And they put me on, because of the medication I was using here in Barbados had me very, very sick. And they put me on medication. And then they told me how to come off of that medication. And that was it from as far back as 2017. I don't use medication anymore. I do not use any medication. And I had operation on both of my eyes. I don't wear glasses. And I can read anything. That's what the Cubans did for me. And that's what they were doing for other Barbadians who were going to Cuba. So I think that, and I'm very happy to be here. I think the Democratic Party need to investigate this. I think the Democratic Party need to look at developing a project with Cuba for healthcare, because there are many benefits that the people of Barbados can gain from a public healthcare program. And we saw the Cubans coming to Barbados during the COVID period. And we saw the work that they did when they were here. Yes, so we sent them back. I don't understand. I mean, it shocked me. It really shocked me. Because there are poor people in Barbados. If you speak to anyone now that would have gone to the hospital and asked for operation in June, they will tell you that they'll be able to get an operation in 2025, August, September. Things are unfair to poor people, especially when you can develop an opportunity with the government of Cuba for training. Because when we train medical doctors, we should be organizing ourselves to bring them back here so they can work in the public health section so that the people can benefit from it. And we should be using the opportunities that Cuba can offer us, and they have already offered us in the area of dealing with diabetics. In terms of even amputation there, they have a system that they can save people's legs. You know, we should be dealing with these things. With Cuba, Cuba may be going through a problem because they may not have all of the medication because of the embargo, but they have trained the medical doctors, and they're helping poor people all over the world, not only in the Caribbean. They have over 400 medical workers in Haiti at the present moment, even though Haiti is going through a crisis situation. So that I am very happy to be here to be given the opportunity to participate in this kind of discussion. But I think we have to take it to a higher level, an honorable level, and an honest level with the poor working class people in Barbados.
Mhm.
Because there are many problems at the QEH. And most of these problems are also being created by our IMF program. Our IMF economic program are robbing the poor working class people of their resources, their financial resources, and then we can't deliver the services to the people so that we can help the very poor in Barbados. And when I come here, I can speak on behalf of the poor. That's my passion that I have always been part of. And I'm going to defend the poor and powerless people. I accept that you must have some form of private sector within the medical industry. But at the same time, I think community medicine is an important area for us. And I think we need to create the conditions for the very poor in Barbados.
Ramon, I think that Denny hit the nail on the head in terms of, because you've heard this sentiment in Barbados that a lot of Barbadians feel to think that healthcare in Barbados is now being privatized. And you get that when you hear the communication officer for the Queen Elizabeth Hospital telling persons not to come to QEH for emergency, to go to the other healthcare facilities when Sir Winston Scott may not be open, the other polyclinics may not be open, so you have to put up money to pay for the private healthcare facilities, which a lot of people don't have. And that's the reason why you're finding this problem now with a number of people going to accident and emergency for treatment, spending 3 days or more before they actually see a doctor or get the treatment, and then a lot of them are actually dying within accident and emergency. So as a country, how can we feel comfortable with this situation, especially after COVID? So that's why we wanted to have this wider conversation about the health and wellness of our people, and then to show up really the deficiency in our primary care facilities, the polyclinics, and also to show up the fact that, as Denny rightly said, this IMF austerity program is robbing a lot of our institutions of vital resources necessary for the said doctors and nurses to be able to administer the needs of the people. As he said, you can't go to the if you go to the QEH for a glaucoma or whatever the case might be, a cataract surgery, and telling you that you have to wait until next year to get treatment, it is ridiculous. Or if you have a back problem and you need a CAT scan, and telling you, or MRI for that matter, and giving you, and you are in pain and in agony, and telling you that you have to wait for until 6 months down the road in order to get that procedure done. By the time you get it, your conditions is probably worse. And that is why a lot of persons are not necessarily making it out of accident and emergency, because then you go home and you suffer with your pain, not getting the diagnostic tests that are necessary. And by the time the whatever it is erupts and become unbearable, you have to get the ambulance to take you to the hospital, and it may even be too late. This cannot be the Barbados that we want for 2025.
And I totally concur. Now, Mr. Denny, he mentioned human resources. He mentioned about, based on the analysis, based on the circumstances he mentioned there, there's a serious brain drain. We have doctors staying overseas. And you mentioned, I believe the hospital short of staff.
Mhm.
I mean, what is the solution there?
Right, that is an issue, because a lot of the medical persons in the medical field, because of the stress that they're under, they're leaving for greener pastures. So some of them may be leaving to go into their own private practice. If you work in any environment and you find that it is very stressful and it's not necessarily working out for you, you are going to go someplace where it is easier. So we're losing a lot of our nurses to places like Bermuda, Cayman Islands, to the UK. Same thing with the doctors as well. Persons that we have trained. If you ask the CEO at the hospital to give you the list of all of the specialties which are covered, I'm certain that there will be a number of gaps because people do not recognize that you have to wait for a pathologist to come into Barbados to do autopsies. And that's why it's taken so long for, once before you die, you can safely say that the funeral will be in the next 2 weeks because the body will be released from the hospital. Now you have to wait and see. And if the person asks for an autopsy, you know that it's a much longer period. And then you also have the number of murders as well, which would need the forensic testing going along with that as well. You have basic specialists for a number of areas that are not available. Persons who are waiting for operations for more than a year simply because the specialists are not there. Dialysis patients who may need to have the ports put in, who have to stay in the hospital for 3 and 4 months because, again, they either don't have the catheters or they don't have the specialists to do the treatment in terms of, the doctor said I can tell me the correct term, for the fistula, to do the fistulas and so forth, which is the safest way of getting dialysis. Because when you have the port, those persons cannot get those ports wet. So you can't take a shower, can't go to the beach. But if you have the fistula, you have a little bit more flexibility. All of these, and then you have issues with persons with the ports ending up having infections and then have to spend periods of time in the hospital setting. All of these are things that we need to be concerned about as well.
But Senator, and fair word, the point I want to make here in relation to Barbadian doctors who studied in Cuba now ended up in Jamaica. A lot of these doctors wanted to stay here in Barbados and give back to the Barbadian community. Okay, so my statement is not an attack against them. But Barbados refused to create the conditions for those doctors to work here and to gain an opportunity to do the part 1 and part 2 of the Caribbean Medical Council examination. Okay? And those doctors felt insulted. And they went to Jamaica. And when they went to Jamaica, the government of Jamaica gave them apartments, give them a motor car, give them maid service, and treat them as doctors and help them through the process, 18-month process, so they were able to do the Caribbean medical examination. And now they can work in any Caribbean country. After that, and after going through those conditions, they felt that they should give back their service to the people of Jamaica, to the government of Jamaica. And that's where we made a mistake. Over 200 students from 1998, we trained in Cuba. Okay? We have doctors, Barbadian doctors, trained in Cuba, working in Jamaica. They're heads of departments, heads of polyclinics, who specialize. We have a leading doctor in Trinidad right now who have a very, very, very big private practice, and he also gives back to the public service in Trinidad and Tobago. Okay, so that we have to seriously, this is a major area as it relates to people's development, because health and wellness is important. And I think that the Democratic Party need to sit down, assess, analyze, and develop a strong program that we could put before the people of Barbados for health and wellness. Because we have a lot of, if you listen to calling programs every day, people complaining for the QEs, complaining for opportunities for appointments, complaining for the way how they're treated in terms of the health facilities in Barbados, and this must become a major agenda for the Democratic Labour Party, because to me, Democratic Labour Party is the alternative government. We have to develop an alternative program or project to what's happening in Barbados because of the IMF program. And health must become part of a major area in terms of dealing with that IMF program. Because a number of people in Barbados are suffering today because of that IMF program. Working class people, all of our social services are being threatened, health facilities are being threatened, workers' rights are being threatened. And I think this is the main agenda. Health and wellness is a key area for us in the Democratic Labour Party.
Some serious money should be pumped.
Yeah.
And this health and wellness in a serious way. The government would have spent $50 million on the World Cup project. Really and truly, I believe that should put some coffers where wellness, health and wellness is concerned.
Yeah, this is important.
Definitely not good enough at all. I can tell you that. We actually have another special guest. Her name is Miss Esther Selman. She's a dedicated nutrition professional with over 25 years. Hear that? 25 years of experience. She earned her Bachelor of Science degree with honors in dietetics from Oakwood University, Huntsville, Alabama, in 1995, followed by completion of the AP4 didactic, I hope I have that right, program accredited by the Accreditation Council for Education in Nutrition and Dietetics, which the acronym there is ACEND. In 1996, in 2001, she graduated with a master's in public health, specializing in health education and promotion from Loma Linda University, California. Now, it's a whole list of achievements and accolades here. It might take me the whole show, but we want obviously to get some thoughts about and views where nutrition is concerned, the foods we should eat, and what we should avoid, etc. Good night to you.
Good night, and thank you so much for having me to join your esteemed audience. It's indeed an honor to be here and to come and speak to you about nutrition. That is one of my passionate topics. I just want to begin with some statistics, and we all know that according to the Ministry of Health and Wellness, 65% of adult Barbadians were obese, 60% living with hypertension, and 20% living with diabetes. And I would have heard you mentioned about diabetes earlier when one of the panelists, he mentioned about going to Cuba and how Cuba helped him to get off his medication, and that is excellent. I believe that as a dietitian, more persons can live a good quality of life with diabetes. And I heard you mention about dialysis, clients on dialysis, and I have been successful in helping clients to get off their medication with diabetes, as well as to be able to manage their dialysis. Another statistic I just want to share with you, according to the Global Food Research Program in Barbados, NCDs, and when they say NCDs, we all know that means non-communicable diseases, they account for 83% of all deaths, and this was in 2016 data. Then we know about the sugar drink tax that was implemented, which was initially 10%, and then in 2022, it went to 20%. And we also know of the National School Nutrition Policy Program, and this was to improve the school food environment for children. So having that background said, we all know that healthy eating is an essential component for us to have a good quality of life. So if it is that we are dealing with NCDs or with children who's growing, let's start with breast milk. We have young children who, when you're born, the first premier food is breast milk. And then as they grow, we want to ensure that they're getting those key nutrients, which would be our macronutrients and our micronutrients. And a lot of research has shown that we need to have a balance of macro and micronutrients so that we can get the ultimate nutrition that our body needs, so we can get our nutrients. In addition to that, there are certain food groups that we consume that will be able to provide the necessary foods to help for growth and development, as well as for managing disease and also for healthy eating.
Sorry, Esther. You mentioned a very interesting point there. Breast milk. That is extremely interesting. You mind just recapping that particular point, please?
Okay. I just wanted to say that breast milk is the superior nutrition for babies, infants, up to some person. The research says up to 6 months. Some person breastfeed up to a year. I breastfed my son up to 2 years. And what is interesting is when you breastfeed, all the antibodies, let's say for instance, you had the mumps or you had measles, those antibodies are passed on to the baby, the infant. So it helps strengthen the immune system. So that is an added benefit of having to breastfeed. In addition to that, it also helps with the brain so that the cognition of the brain lasts up to 15 years old. So when you breastfeed a child, it helps them to be more, much better academically. And I proved that with my son because he started college at 16 rather than 18 like most children would. So I definitely can see that the benefits of breastfeeding.
So basically, healthy mommy, healthy baby.
Healthy mommy, healthy baby, yes. Healthy lifestyle.
Healthy lifestyle. Okay. Now,
Go ahead.
okay. Now, in terms of diabetes, right? Some people warn against lots of carbohydrates.
Mm-hmm.
Lots of carbohydrates, right? I know you can still use some, but obviously to a certain limit, right?
Mm-hmm.
What are your thoughts?
I always say that carbs are not the enemy. Most times the thing about it is that diabetes is about carbohydrates for sure. But the type of carbohydrates that you consume is really important. So how I like to teach my clients, I usually say to them, you want to consume more cruise ship foods than speedboat foods.
Cruise ship foods than speedboat.
Right.
Simple carbs and complex carbs.
There you go. There you go. So, for instance, if it is that you are consuming a meal, you want to avoid, and you are a diabetic, you want to avoid those simple carbohydrates, because what is happening is that the blood sugars will go into the bloodstream at a faster rate. And that is something that you want to pay attention to. You want foods to go into your bodies at a much slower rate. Hence, the reason you want to select and choose your complex carbohydrates. So carbohydrates are not the enemy. It's just the type of carbohydrates that you consume.
The type of carbohydrates.
Yeah.
Right. And I know that Dr. Hinds and Dr. Wickham can corroborate, obviously, everything that you are saying. Now, okay, the type of foods you should be consuming as a diabetic.
Right.
What are the type of foods you should be consuming?
Right. So you want to choose foods that are high in fiber. So let's start with if you were to think about your carbohydrates, you want to get more whole foods. So whole grains, foods in its natural state, like green banana, green plantain, you want cassava, you want your grown foods. those are the ones that's really high in complex carbohydrates. And then when it comes to putting your vegetables, you want to have your leafy greens. And I find that a lot of persons do not eat enough vegetables, and we need to make sure that we're getting a good balance from our vegetables. And then if you were to think about fruits now, right beneath the skin of the fruit is where the fiber is at. So we tend to peel our fruits. Or if it is that we are cooking, let's say for instance, you're cooking pumpkin, you want to peel it. No, you should not peel it. You need to keep the skin on. And then the legumes, the peas and beans, they're also power packed with complex carbohydrates and with fiber, and they have no cholesterol. So that's going to be added benefits as well right there. So that is the type of foods that you want to select more when you're planning your meals for someone who's a diabetic, and then limit your lean meats, limit your fats.
All right. Ms. Salmon, well, we have Dr. Wickham and Dr. Hinds here. And we heard Dr. Hinds spoke earlier about the need to having, he would have been glad to have a nutritionist at the clinic on a daily basis to deal with their patients. So both of you, I would like to hear how easy or what challenges do you find with your patients in getting them to stick to a proper diet?
Well, I think it's important to first let them understand the etiology of diabetes, what diabetes is all about, and how foods respond to the body when you eat. Let's say, for instance, when you have a soda, or if you were to have a bowl of oatmeal. Letting clients know that you don't just want to eat one food group, but you want to have a balance so that you're having a complete meal, because it's really essential for us to have a complete meal so we're getting our macronutrients as well as our micronutrients.
You can jump in.
Yes, we often will have to, in our office, work through these with clients. We often had to do this at the polyclinic as well when it was there, mainly because we didn't, as Dr. Hinds said, have the services of a dietitian, to spend that time with the clients working through those issues with them. One of the challenges that was the case when it was in the polyclinic and remains now, and you will hear this regularly, is the cost of the healthier foods. I definitely concur with all this Salmon mentioned regarding the types of carbohydrates and so on that we advise, and we try to work through with clients about show them. I draw graphs and show them how simple carbs, will cause the blood sugar to spike, complex carb better over time, etc. And we try to work through with patients based on what they can afford, and also try to show them that sometimes persons can afford healthier food than they think, from the standpoint that you may not have as wide a range as we want ideally, but you work with the person's budget and say, well, look, okay, if I have this amount to spend, well, perhaps you could consider this, perhaps you can consider that, where you're still trying to get as all of the food groups as much as is possible. Unfortunately, sometimes persons will still land back at this statement: bread is cheap in Barbados. So I find in Barbados we use a lot of bread, a lot of flour. I mean, all of the bakeries in the last 2-3 weeks over the Christmas season, I mean, you should see the lines outside of the bakeries, but persons will say, oh, it's because it's cheap. So they will tell you that they know about the complex carbs, and they know about the non-leafy vegetables, the beets, the carrots. They know about all of that stuff, but they have to go with what they can afford. And that I cannot underestimate how significant that has been. I mean, I had someone in the office told me, within the last 2-3 weeks, he had to decide between paying a bill and affording non-starchy vegetables. He had to make that decision. Got to pay the bill, but then you need to eat. So you end up eating something that's not ideal. A lot of refined processed foods.
As a Dr. Hinds, you find sorry, Esther. Just asking, obviously, Dr. Hinds a question regarding do you have to hold your clients, or feel like holding your clients with the scruff of their neck and say, look, don't eat this?
Well, you see, it has to do with culture and education, because I find that persons who are sort of not innovative, but they have learned how to prepare a lot of special foods, and they are very into vegetables. You know, you get them prepare a meal. They prepare. It's a little expensive because a lot of people prepare vegetables with olive oil. You know, olive oil is not cheap, right? But you find that you go to certain person's home, they prepare a lot of special foods because they have learned how to prepare them, you know, and it's not that expensive. But you find that a lot of patients, they don't have that education, but that skill, okay, and it's a challenge, okay. But if you have that skill, you learn how to just prepare these foods, and they're very healthy. You know, you can have let's say pumpkin, right? I've seen people prepare a lot of special dishes with pumpkin. You know, the average person don't. You know, they say pumpkin, they make conkeys. You know, that's it. You know, and with something like okra. You know, I've seen people prepare okra in a lot of special ways. And you know, you usually have the debate between callaloo and cuckoo. I'm sorry to say callaloo takes the cake. Callaloo definitely wins. And when you get someone prepared callaloo properly and tasty, it's enjoyable to eat. You know what I mean? And it's much more healthier than cuckoo. Cuckoo is a carbohydrate, you know, and it's not one of the complex carbohydrates Esther that spoke about. You know, we obviously you must have complex carbohydrates, you know. And although it's not a national dish is not the healthiest. Okay. And I will go, you have to re-educate and learn people how to prepare these special dishes. Because it works out in the long run. Okay? Works out.
So, Ms. Salman, then, on that note, this is where you come in. How would you handle that challenge in terms of getting people to think about healthy nutrition, especially in the start of the new year, and affordable ways in which you can maintain a healthy diet?
I'm glad you asked that question because I was here just reviewing my my practice. Now, when a client comes to me, I would plan a meal, I do my nutrition assessment, and at follow-up, I take them to a supermarket tour. So I take my clients to the supermarket and I show them how they can still eat healthy but cost effective. So that is, it is possible to eat healthy on a budget. So that is one benefit. The other thing is cooking. I also incorporate into my practice cooking demonstrations. So I show my clients how they can prepare healthy meals that are, again, tasty and cost effective. And they cannot believe it. So, and I prepare it right there in front of their eyes. So they get to see. So it is possible that you can have a good quality of life. It is possible that you can be cost effective and still maintain your blood sugars control and or whatever health your health concern will be or what your health goals would be. It is possible.
Well, Ms. Selma, I'm going to ask a big question here now, and I think a lot of the viewers as well would want to ask you the same question in terms of alcohol, drinking alcohol. You know, some people say that
Juice?
one glass of wine a night. You know, you can go along with that. You can live healthy with one glass of wine a night. Some people would say that. What are your views? What are your thoughts?
Okay, I'm going to answer your question this way. Now, remember, I would have mentioned about macronutrients. I remember I would have mentioned about cruise ship foods and speedboat foods. So 1 gram of carbohydrate is 4 calories. 1 gram of protein is 4 calories. 1 gram of fat is 9 calories. 1 gram of alcohol is 7 calories. Now, if it is that we're looking at diabetes and we want to limit the amount of sugars that go into your bloodstream at a faster rate, alcohol will be one of those foods that you will want to be able to manage much better with consultation with the dietitian, so that you can know how to, balance the intake. The other thing, as it relates to having good blood sugar control, yes, you may, the data is up there that speaks to how many ounces or a daily drink, but you have to pay attention to the fact that that is also going to can cause your blood sugars to go up high. In addition to that, we are looking at obesity and being overweight, and I would have shared with you the statistics and the data with Barbados of how with the high rate of obesity and overweight is in our country. So it is like what you want best out of your life. Do you want to have either use your alcohol and have high blood sugar, have overweight, obesity, premature death later on, disability? Do you want that type of life, or do you want a life where you're going to still be able to get up, you're going to be able to look after your children, look after your family members, your grandchildren? Which quality of life do you want? So I think that if you think about it that way, you will know the best choice that you would want to make.
Yes, we actually have a comment here from one of our viewers. She said she thinks that we need to take a more proactive approach to health by implementing preventative health, meaning mandate that children have an annual checkup. Now, we have obviously a guest here, Mr. Babb. He deals with the youth. In your teaching and so forth, in your experience, you are physical education, of course. You're seeing a lot of obesity.
Yes.
You are? Yes.
Very concerning at this point in time.
Yes.
And that's because of the sedentary lifestyle that we have, that we're seeing, and children not playing as much. They spend much more time on the telephones and tablets.
Yes.
So we are encouraging the use of technology, but we are also creating a situation in terms of movement and health. And I'm saying that what VHOIC says in terms of checkups, we may have reached that stage so that we're not dealing with a situation where we could have prevented it. That unhealthy practice at an earlier stage, and it spins off into our adult life.
There's still people around the school that come around selling the corn curls and tomato balls and stuff like that.
That means that I have seen a reduction in yes, since the quote unquote the healthy
National School Nutrition Program.
Yes. But what has happened though, because you say you want to have a healthy program, eating program, which is promoted by the canteens, but if they go there and the food at this point is expensive, then that cost then becomes that for the children and the parents to bear. What you're seeing though, that they're holding their money on evenings, what they can afford, and when they see the pizza man and those little things that they have, they're spending more money outside of school than at the canteen. And that is the problem. So I'm saying that we're saying showing concerns about our health of our nation, but we have to provide the atmosphere that the food is affordable for adults and children within school. But we still got the money that we're giving our children is not going to increase, but the cost of food is going to increase. Yes, I think that Miss Simon wants to say something.
Definitely.
Yeah, I just want to, can I speak? Is it okay?
Yes, please. Yes, please.
Okay. I just want to mention about backyard gardening. And one, you're increasing physical activity. When you are going outside, it can be a family event, so you're bonding with your children. And in addition to that, we're also going to be having items that you can reap, which will help in decreasing your cost to your budget as well. So that's another aspect of incorporating healthy lifestyle, healthy eating, and also cost effective to your budget.
I was told that you have a promotion that you would like to share, a challenge
Yes.
viewers. Yes, yes, please. Can you
Yes,
tell us a bit about that?
yes. On Sunday, January 12th, I will be doing a 7-day water wellness challenge. And I will be actually every week, I'm going to be doing a different challenge. So I'm going to be doing that straight for the next 4 weeks. But this week, the first launch of that program will be a 7-day water wellness challenge. You have to participate. It's going every day. I will be sending you emails for those persons who register. It's a free program, but we need to register so that I can send you the information so that you can have lots of activities. It's going to be very exciting. I mean, I have put my all into that. My team and I, we are working diligently to ensure that we have a healthy Barbados in 2025.
Okay, so all it takes to be a part of this challenge, we have the poster, the QR code, so we
Yeah.
need to hydrate. But
That's
what
it.
exactly will we have to do for the challenge?
So every day, but first of all, you register. When you register, you will get an email with the different activities that you need to participate, that you will be engaging in. So every day is an activity that is going to help you towards hydrating to elevate. It's very simple, no stress, but effective.
I'm one of those people that don't like things popping up at me once, and so you want to give us a little heads up to see if I would really get on this water challenge and I can keep up with it. I like to know ahead.
You like to know ahead? You don't like suspense?
I don't like surprises.
Well, just to give you, you see, I want to keep the suspense there as well. But just to give you a sneak peek, we're going to be having things that I'm going to be challenging you. So each individual will be challenged. When you do the registration, there are certain questions in there that speaks to the amount of water that you normally would take in a day. I'm going to be teaching you how to calculate your daily water intake. That's going to be in day one. How to
That
calculate
sounds easy.
daily water intake, because a lot of times we drink water and we don't realize that we can actually sometimes overhydrate. So we can drink too much water and then your electrolytes, you have issues. So you don't really want that. So I'm going to be teaching you how you can calculate your daily water intake. And then we're going to be there are some persons who do not like to drink water. So I'll be showing you how you can drink your water, how you can make your water flavorful. So it's going to be different activities like that. So
Well,
I look forward to having you join us.
Yeah, but
Yes, so I will definitely take up the challenge, and I would encourage all of our viewers to take up the challenge as well. The poster is there on the screen.
Just
If
send
you
the
can,
code.
you should be able to scan the QR code on the poster, but we can probably put it in the chat. I don't know if that will be possible, that persons can download it from the chat and scan the QR code. And I would encourage persons, this is the start of a new year, and to take on a healthy challenge and get involved. And you said that every week there will be something else that you'll be
Every week a different challenge, and every day you're going to be getting an email to help support you and different activities for that 7-day challenge. So each challenge is going to be, you're receiving an email daily. When that challenge is finished on the 18th, then we're going to start another challenge.
Just to be sure, though, because again, I said I don't like surprises, but none of these challenges would involve 100 push-ups.
I don't think so. No.
All right, well, then I will be on board with your challenge.
You will have to check with your PE teacher. Your PE teacher will do the push-ups.
Okay, then.
we talk about, I'm glad we're on the topic of water. How much water should we drink?
That is the reason why you have to do the challenge.
All right.
Yes, I think
You do the challenge.
Based on your research and what is recommended.
Okay. Okay, right. So so it depends on the certain things. Like for instance, let's assume normally you always hear 8 to 10 glasses of water in a day. But you have a guy who's working in construction. He is going to be perspiring, so he's losing electrolytes. Therefore, he's going to be also need to hydrate himself. So then his daily water intake may be 10 to 12 glasses. Now, you may have some persons who maybe have a health condition, and that's one of the questions that I asked. Do you have a medical condition that may prevent you from drinking water? For instance, some person who may be on dialysis, some person with congestive heart failure. Those are persons who need to watch and limit their fluid intake. So, and that's the reason why we need to, it has to be personalized, so it will be personalized still, even though it's sort of a group effect, a group effort, because we still want to make sure that persons stay within whatever medical condition that is going on, that they still stay within the requirements that is needed by their physician.
Okay, I don't want to put you on the spot, Esther, but you're facing
easy.
Huh?
Question easy.
Okay. There's a cultural change in our society. Now, I used to fly kites as a little boy. As well as anybody my age. I used to be flying kite. And flying kite involves a lot of physical activity, you know. When they pop, they go run behind it, you know, you teeth in kites, all types of stuff, you know. And you pitch marbles. And pitch marbles, you got to move around a lot. Actually, at 9 in the summer or any vacation at 9 o'clock in the morning, you get to go outside. And go outside involves a lot of physical activity. You play catcher, all types of things.
Yeah.
Children nowadays do not go outside. They don't pitch marbles. They don't fly kite. They don't do none of those things. They play on their devices, you know. And that is a cause, that's one of the causes of the obesity. So what is your plan? You understand? You have to have a plan. Well, you have to, but I think there should be a plan to combat that. And what is your plan? What are the things that we should be doing?
Well, so if you're talking about physical activity, I actually wrote down on when some person was speaking earlier, I think it was a PE teacher, and I wrote down hopscotch and I wrote down skipping, because these are activities that our children do not really engage in. I grew up on that too. So I grew up playing hopscotch, skipping, Mora, all of those Chinese kids. Actually, when I actually got my hand dislocated when I was running to the waist length of playing Chinese skip, and I fell down and had a blackout. My shoulder got dislocated. So I'm saying we have to be able to find innovative ways on how to get our children back out. Like, for instance, I don't have any little kids anymore. I have grandchildren now. But my grandson, I get him when I travel or, shopping or anything like that, I get him games that he can be more active in. So, for instance, Frisbee is another game that you can get the kids a Frisbee. So we can get our kids, our children, activities and games that will engage in movement. I have another little boy who comes by my house, and he has some marbles the other day. So I was showing them how we can pitch, how you can use your marbles. So these are things that we need to go back to the basics of different types of activities that we can engage in. And I'm sure that the PE teacher can incorporate those in school. Skipping, you can do a competition with skipping to see who can skip the longest. How you wanna take that challenge with me?
Of course. Of course, I can still do it at this age.
I think Dr. Wickham wanted to make a point.
Yes, definitely. On the point, the challenges we are faced with children, I like to remind persons, I'm a parent myself, I have two lovely children. Children do not born themselves. Neither do they raise themselves. This comes to how we parent. And I would remind us all as parents that our children's health will impact their adult life. We tend not to think about it, but definitely the school nutrition policy and hearing that the team behind that, this is one of the things they're emphasizing, that childhood health impacts adult health. So a child, for example, who is significantly overweight, obese, is going to have more health challenges as an adult. So, I would remind parents that, how you raise your child, the things you let them eat, the activities you encourage or fail to encourage them to be involved in will impact issues they may have with obesity as adults, diabetes, etc. Sometimes the device is given to the child to babysit them, to keep them quiet. One of the things I did with my children, I insist they had to go outside because, like you were all right, I grew up outside running about and playing. They do a lot of studying, they definitely do, but at a certain point, I was all right, put on the books, get outside and run about. Don't hurt yourself, don't kill yourself out there, but literally get outside and run out. Do something outside. Also, you're very careful not to appear as if you're telling people how to raise your children. You're just making some gentle suggestions. But the device, I think the earlier you establish good rules and boundaries regarding how devices are used. So we're not talking about waiting until a child is an addict 3 and 4 years in. We're talking about from their very first exposure to devices, because technology is wonderful servant, I tell persons, but these devices can be terrible masters, but wonderful servants, fantastic in terms of what they can do. But I suggested to parents, from very early on, establish reasonable boundaries, but they need that physical activity. And that is something that has to come from parents, not leaving it for the child to decide. But at the same time, you can't wait, like I said, until a child is 4 years into a serious addiction, then to try to implement, physical activity. So from very early on, establishing boundaries, but getting outside, getting involved in some kind of physical activity. Hopefully they can find one that they like, because you're not going to be able to deal with the chronic lifestyle, chronic non-communicable diseases with just diet alone.
True.
Physical activity has to be a part of it, and safe physical activity.
Now, you mentioned physical activity, right? Obviously, in terms of parenting and physical activity, the role the parents play. You've had any situations where a parent told you, look, not my child?
Yes.
They may put that
So
like
we even faced with situations where we have excuses being written by parents that they should not be playing at this point in time. So it's about education for the parent as well as the child. I speak to them, we talk to them, I explain how important it is. So therefore, yes, we are faced with it, but we are teachers. We have to guide them. And when we have a situation, we have to call in that parent to say to them, look, you're doing a disservice. And this is very important for the child's development.
That's very correct. Now, another question I would ask, in terms of coffee, some people ask questions about coffee. Is it safe to drink? Can you go ahead, even if with a little, heart condition, can you drink coffee? That's the question I will ask.
That is for me?
Yes. And then we're going to pass it on, obviously, to the doctors.
But just remember that coffee contains the caffeine and it can accelerate your heart rate. If it is that you have, and there is data out there that speaks for, which is the pro, and also the cons for coffee. So you have to look at medication. Some persons on certain medication that they're on, so you may need to avoid it. You may have a health condition that you may need to avoid it. So it all depends. I know that for some other persons, it's a quick boost of energy. But if you want a quick boost of energy, just eat watermelon.
And Dr. Wickham?
So as Esther said, there's data out there for and against. It's individual decisions, not for everyone. There are persons for whom it doesn't appear to bother them, but definitely there are persons with a number of medical conditions where coffee can be a problem. Remember, the issue though isn't just coffee as much as it is the caffeine content. And we have to then look at a number of other products that persons use that contain significant amounts of caffeine. There's a lot of energy drink usage that takes place, that occurs. There's certain pain relief medications that part of what helps them to work better is caffeine. So it's not for everyone because there are issues both with usage in terms of effects and mal effects that you can get, and there are even issues with caffeine withdrawal. Some persons, for example, will get terrible headaches when they try to come off caffeine that they've been on for some time. At the same time, the others will tell you that caffeine works for them. So, individual decision, but definitely there are significant health issues that can occur, particularly those who suffer from heart rhythm problems. That is, their heart doesn't beat properly the way it should, the steady book. They have irregular heartbeat, particularly on the faster kind. You use too much caffeine, that can be a significant problem.
And Dr. Hinds,
Yes, sir.
I think someone would have made a comment about energy drinks.
Well, yes.
I mean, those having caffeine as well.
It's reality for a lot of energy drinks, you know. And as I said before, Dr. Wickham emphasized that there are pros and there are cons. Okay, and I think it's a beta adrenaline agonist, right? So what it does to the heart, it accelerates the heart. And what it does to the lungs, it dilates the bronchioles, right? So there's one use of it, which I think that everyone should keep coffee at home if you have an asthmatic in the house. Okay, because that if you can't find your inhaler, you know, the only thing that I know in the house that will dilate the bronchioles and get the lungs open is coffee. Okay, so a good dose of coffee on the way to the hospital is a good remedy to at least get the bronchioles open and get air in. Because the problem with asthmatics is that the bronchioles shut off and they can't get out air and they can't get it in. Okay, they usually the ventilating the rescue inhaler, they take 2 puffs and that sort of dilates the bronchioles. But coffee can have the same effect, you know. So it is a lifesaver in some cases, but drinking it every day is up to the person. If you have a heart condition, avoid it.
I just want you to tell the viewers there how dangerous it is to mix energy drinks with alcohol.
Well, yes, because alcohol is a sedative, and the energy drinks is what you call it, stimulant. Okay, so you're mixing a sedative with a stimulant, and you know, and it's not a good combination, right? Especially on the heart, because you're stimulating the heart, okay, and reducing the ability to make good decisions and stuff. You know what I mean? And you're not doing yourself a favor by consuming both at the same time. But these, I can't remember the names, or I should have called the names. But all these energy drinks that they have, people mix it with alcohol, you know, and it's not a good thing to do.
Yeah, the combination can also cause a significant rise in your blood pressure, for sure, because strong alcohol can do that, the energy drinks can do that. And a point to be made about most energy drinks is they contain large amounts of simple sugars, high glycemic index, so they're going to spike your blood sugar level, bad for diabetes, and even for persons who aren't diabetic, frequent use of them can increase the likelihood that they become diabetic sooner as opposed to later, because they'll be constantly putting their pancreas under strain to deal with those sugar spikes from the simple sugars that the energy drinks contain. I noticed some now contain artificial sweeteners where they have reduced the sugar, artificial sweeteners, but artificial sweeteners are quite controversial. Yeah.
Esther, I'm gonna give you your final comments at this time.
Well, I just really want everybody to understand that healthy eating is not a chore. It is not expensive. You can live a good quality of life just making healthier choices. And if it is that you are unsure what you need to put in your pantry or to put in your shopping cart, you can always check with a dietitian who can guide you into healthier, making better choices.
All right, and so I want to thank you for coming on to the show tonight, and you can look out for my registration for the challenge, and I hope that you have inspired other persons to actually take on the challenge as well. So join me in taking on this Hydrate to Elevate challenge this week, and then we will look out to see what is coming in the following week. So thank you very much. One person already started the registration process. All righty then. So that is good. And I will definitely be joining the challenge as well. And we also look forward to having you back because you shared a lot of interesting information, just touching the tip of the iceberg with regard to nutrition. So we definitely want to have you back again.
Okay, thank you. Thank you for having me.
Thank you, Esther.
Thank you.
Thank
Nice
you.
meeting y'all.
Yes. So I want to talk about amputees. In Barbados, we have a large number of amputees. Are we too quick to amputate? You would say?
Well, let's look at the three main reasons why you get an amputation. Person usually have either an infection with the foot, which has the propensity to spread. You sort of saving the person. You don't want it to spread, because if it spread, they become septic and they might die. So remove the foot before it spreads. Another reason is circulation. Some people have very poor circulation in the foot, and that poor circulation can lead to some type of gangrene. Okay, so remove the foot before it gets to. That is they usually do we call a Doppler test, and we look at how the circulation is in the foot, and sometimes some people don't even have a pulse in the lower extremities. So you need to remove the foot. And it's usually signs they become discolored, become dark, becomes person can't feel in the foot, so they remove it. So to avoid that, to avoid it being amputated, we need one of the things you can do is early detection. There is a procedure where the person can have like a graph of the blood vessel that supplies the lower extremities, right? That's pretty early. You got to get that early, and that is like the person have to come early, And some people don't come early. They come late. They come when they see the foot changing color, or they turn up when they can't feel the foot, and it's too late by then. In terms of infection, if you hit the foot, or because usually in diabetic foot they can't feel, so they either step on a top or step on a rock and get it cut. And the rule is you're not supposed to let the sun rise if it happens in the night, or let the sun set if it happens in the day. Okay? Because the foot have a tendency for infection to spread very fast. So usually these people turn up a week later.
2 weeks later.
When the only thing you can do is to amputate the leg to stop the infection from spreading, because the whole limb is designed in layers, and the infection is spread through those layers very fast, very, very fast. You can have someone, if you give them another week or so, they got that infection spread all up the abdomen. Okay? And it's not a good thing. So that's the reason why you get it, or a lot of infections. It's not so much so that we are doing lots of amputation just willy-nilly. It's that a lot of patients are turning up late. Okay? They turn up late. And the only management at that time is amputate the leg.
But I feel this strong need to hear more from Mr. Denny about his fight.
Well, I'm not a medical doctor, but I would recommend that.
Cuban
I mean, in
program.
terms of the Cuban
Well,
championing of
Well, Cuba have offered to help us in those areas, and Cuba have developed medication that can help you. in those areas so that you can save the life. And I think it's something that we should investigate and work with Cuba, because a lot of these poor people that have to remove their legs up, who are working and who want to make a living, and still want to be able to contribute to society. So I think we need to. I understand what the doctor is saying, and I respect what the doctor is saying. But if Cuba have an alternative program and a project that can help, I think we need to investigate and to create the conditions for our people, especially those persons within the public health sector. But there are a number of people who may end up turning up to the doctor at a late stage because of their economic background. They may not have the finances and the ability to cover the expenses immediately. But I think that if they are given an opportunity to have a wider cross-section, consultation at the public health level, that it will help. And I think I don't think we should always look at bringing Cuban doctors to Barbados. I think the whole idea should be centered around retraining Barbadian doctors to deal with these issues within the public health hospitals. Because I think we need to have our people in Barbados, especially poor people.
So it's always known that in terms of healthcare in Cuba, they were top class. Top class. In terms of the pushback you received, tell us about that. Tell us about that pushback. Yeah.
Man, it's a big pushback. I mean, and you can look at the evidence. When we were organizing the IKEA program between Barbados and Cuba, lots of poor working class people benefited from that process. I mean, the Cuban get the eyes checked and get the operation. There was a Cuban doctor here at Winston Scott Polyclinic who would have examined the person before they go to Cuba and then advise. And that helped. I don't know why the government of Barbados stopped it. With the COVID situation, Cuba helped us in many areas in the medical engineers and nurses and doctors and so forth. And that helped save the lives of a number of Barbadians. And they were able, this is a third world country we're talking about, and they were able to send hundreds of doctors, but thousands of doctors all over the world to help, poor nations in Africa, in Asia, in Latin America, even in Europe, but there were hosts of doctors in Italy. So that I think that the DLP as a Democratic Party should do a study on these areas so that when you write the manifesto, you can address some of these areas so that when we win the government, you can create the conditions to help poor people that need medical help. Because it's not only Cuba. I think there are other countries in the world that will be willing to help us in the area of medicine. Because not only the professional doctors may need machinery, there are many other areas. There are Barbadians who live outside of Barbados that may want to contribute to Barbados in terms of buying small pieces of equipment to help us medically. So I think that this discussion is a very important discussion for Barbadian people. And the Democratic Party can create the conditions for us to help our people in Barbados and to help our people when they go to the QEH for medical treatment. Because the workers at the QEH, I know that they want help, but they don't have the facilities, they don't have the equipment, they don't have the materials because of the IMF program that denying us an opportunity to buy and purchase these things for our public institutions. So we have to address these things. So we have to come up with an alternative program to the IMF program.
Exactly. You're very correct, because even at the start of this year, at the hospital, in terms of simple supplies such as gauze and saline solution, because of the austerity measures in the IMF programs, the funds were not there to purchase a number of these things. And you don't have to convince us anymore. Anything that can be done to assist Barbadians and improve the quality of healthcare, the Democratic Labour Party will definitely champion that. But what I wanted to ask you right now, at this current stage, what are the steps if someone, wanted to get that assistance from Cuba, say for a surgery for glaucoma, cataract? What are the steps that they would need to take?
The first step is that they need to get a letter from a doctor, a medical doctor in Barbados, explaining with the issues and the problems. And they can do two things. One, they can go through a commercial section that's set up by the Cuban government for international medical treatment, or they can maybe approach the embassy if the person is, don't have the finances to cover those expenses, and then the embassy could put for a recommendation. And once Cuba can help, they will help. The only problem is that the person may need to help pay for the medication because of the political economic embargo against Cuba, which is it's very hard on the Cuban government. That's one area. The second area is that if we can encourage the government of Venezuela to go back to that position where they're prepared to help finance a project for Caribbean people, because a lot of the finances came from Venezuela through the Petro-Caribbean Agreement and the ALBA Agreement. If we can get them to go back to that position where the government of Venezuela can cover most of the finances, the professional people are there in Cuba, and then you'll be able to have the necessary equipment, the airfare, and to transport the people to Cuba, then we can put back that kind of free program, so that the Democratic Party should do a kind of an audit on this whole medical project and see where we can get help from all over the world, and so that we can help our people. I am prepared to help with such a project because I know it will help the people of Barbados. And we need to create a joint project with the government and people of Cuba that we can train medical doctors, nurses, and engineers in Cuba, bring them. And I know it'll be cheaper for us than if you send them to the University of West Indies. Bring them back to Barbados and let them work within the public health sector and help our people.
Are the doctors still having difficulty finding persons who are trained in Cuba as doctors, still having difficulty finding placements in the healthcare setting in Barbados?
Yeah. You see, the problem in Barbados is that once you study in Cuba, or you study the Commonwealth, there are problems. So you need to do the examination, Caribbean medical examination. And for the Cuban doctors, Barbados haven't put a proper system in place like other Caribbean countries for you to go through that process and to do the examination. And when most of our doctors go to Jamaica, they end up staying in Jamaica and living in Jamaica. And then some of them may end up going and work in first world nations, England, United States of America, Canada, and so forth, maybe to make large sums of money. But that's not the reason why we send them to Cuba. We send them to Cuba so that they can come back to Barbados and help our Barbadian poor people. Okay, because a number of these students that went to Cuba to study medicine, a number of them could not go to the University of West Indies because they don't have the financial resources, and they receive everything in Cuba for free and receive a stipend in Cuba while they were studying in Cuba. So that we have to look at this project or program in a way that there's a strong agreement between Barbados and Cuba for training, and that the doctors can come back to Barbados, work within the public health sector like any other Caribbean country, and they can do the camps, the examination in Barbados, like any other Caribbean country so that they can become qualified doctors, so that they can properly register with the medical council, and that there will be no problems. We need to do our homework to accommodate our doctors, and it's really hard, on us when we can send over 200 medical doctors to Cuba since 1998, and you know 5 or 7 working in Barbados.
And I see from the screen that you're getting some support from the audience with one of our viewers saying it sounds like a great plan, Mr. Denny.
Yeah.
And I definitely do agree with that, because that is why we wanted to have this program tonight, because you cannot we have our healthcare system in Barbados has the footprint there already with the setting up of the polyclinics throughout Barbados, but they're not necessarily functioning as effectively as they should be. We did not speak tonight about dental health, and that is another area where we are falling behind in as well, right? And, not only getting involved, as you would have also suggested, not from the perspective of the Cubans helping us, but also helping us to develop ourselves so that we too in Barbados, this is the stage that we should be at, should be offering this medical assistance to our Caribbean neighbors and setting up health tourism as a next sector for the growth and development in Barbados.
Especially the elderly.
Exactly.
Health tourism for the elderly, I feel, honestly, I feel that the Democratic Party is ready to create a new vision for Barbados, especially from listening to the spokesperson from the Democratic Party. And I think that if we can all work together, we can develop that project that will benefit poor people in Barbados. And I mean, I honestly, and I am not dreaming, I have been listening to the leader of the Democratic Party, Ralph Thorne, and the spokesperson from the Democratic Party on education. I mean, I see something in her and other spokesperson, agriculture. I just read a document on agriculture. And I think that you're on the right path. Just look at creating an alternative to that IMF program. I think that's key. And I know that you'll be able to create the conditions for all of our social services in Barbados.
Well, I'm glad, and it was music to my ears when you said, when we win the government.
That's why that's the reason why I'm here.
Yeah, that's definitely so. Now, we speak about, wellness, health and wellness and so forth. We speak about the physical side of it. We speak about biology. Now, you have you've done some research in terms of the spiritual side. Tell us a little bit about that.
Research as much as it's been a part of my life for decades now. For me, and then this goes to even the definition of health that is used World Health Organization. It's not just the absence of physical disease, but it speaks to mental and emotional well-being. And I've always believed in balance, so that it's not all about physical only. You have to take care of your mental health. You don't have to ask too many adults how they're feeling regarding this thing called stress to hear from so many of them. They're stressed about a lot of different things, a lot of different reasons. So that has to do with the emotional or mental burden that they feel facing various life challenges, and also what support systems they have in place, or what do they lean on to help them handle those mental, emotional, spiritual challenges. So for me, having that church community, has been very important. My relationship with God is not just a Sunday morning thing that you do. That's a crucial part of my life. I absolutely believe that it has helped me through many a difficult moment. The peace that comes in spirit from being able to pray to God and have Him answering and give me that calmness. On the point of stress, regularly in the office, we have to address this because stress significantly impacts persons' lives. In fact, I tell persons I'm convinced it impacts diseases and even quality and quantity of life in ways that we may not fully understand and appreciate. Persons will often come into the office, sit down, the door is closed, and they start to talk, and tears begin streaming down the eyes. Persons are dealing with a lot. You saw that before the pandemic, during the pandemic, and even since. And you know, you have to then take on the role of counselor. They may have come about one particular issue, a rash, for example, something as simple as a rash, and we begin talking, and you realize there's so much more that they're dealing with, and you now have to address their mental, emotional well-being, which is why, you know, I view family medicine primary care as looking at the whole individual, and in my practice, that's what I try to do, not just deal with, you know, my toe is hurting, I have a rash on my skin, this is my blood pressure reading today, but you have to look at all of the factors that influence how you are doing generally. If not attended to, chronic stress, for example, can worsen diabetes, can worsen hypertension, can definitely increase risk for some types of malignancies, cancers, according to research. So, you know, the mental, emotional, spiritual side of us need to be looked after as well. Absolutely. So that health is about the entire person.
No, we're getting into a different aspect of mental health and the youth. You work with a lot of youth and sports as well too. You know, sometimes you have to play a counselor, etc. That is the case.
Of course.
Yes.
Especially if competition, you can see a
Of
stress
course.
athlete being affected, his performances,
Of
and you
course.
know that once they're stressed, and even for exams, they become very stressed. And today we have a stressful situation where exams were delayed at the gymnasium for 2 hours. That is a stressful situation where
Yes.
children who may have not eaten since the day before,
More.
and they turned up for 9 o'clock, but they had to do an exam probably hungry. That adds to their stress. And I believe that in terms of the mental and emotional, I'm encouraging parents to make sure that the children get to school early on mornings, because when you have the morning assembly and they're there and you have the talks from teachers or special guests, it sets the tone for the day at school. So it's very important that they come to school very early for that part of the day.
And let me just say this: I find that it's very taboo, right? It's still taboo, youth and mental health. Now you go, you tell a parent, I feel this particular way. I get on with it, you young man, you got to worry about, But it is very important
You have
that
to
we,
listen to the children.
we need to take it out of that taboo
Yes.
conversation.
You have
No
a
doubt
serious
about it,
talk.
of
You have
course.
to have a serious
Because
talk.
and it affects confidence, stress affects how you play a sport, of course.
Performance overall. It affects
Yes,
them
of course, overall.
right across the board. And you see, and sometimes you wonder what they're feeling in terms of their exam, but they're stressed about some other areas. And they can be stressed because there's not much food in the house. They have to share with many of their other siblings. So that can create a stressful situation. You see them act up at school and you wonder what is happening.
Of course.
Yes.
Now, in terms of guidance counselors, right?
Yes, I believe there are many at secondary schools.
There's
Yes,
still
but-
that program.
Yes,
that,
still going on.
Still going on. Yeah, but that is very important. That is extremely important. That I think we should take mental health. Same with you get a cut or you don't feel well physically. Mental health that is a real thing. That is a real thing.
Very much so.
That's a real thing. In terms of medication and so forth, where mental health is concerned, is there reluctancy to obviously prescribe medication where mental health is concerned?
Well, mental health is a new thing, Before, if you were taking medication for mental health, you're taking psychiatric medication, and they tend to leave this sort of bland look on person's faces, you can tell that, oh, he's taking psychiatric medication, you know what I mean? So the medication for mental health, that's a new thing. People don't want to go on things like lithium and so on. It's psychiatric medications, right? So we have to carve a new path and say, oh, this is used when a person have a challenge in depression or so on. because now the medication for depression, I mentioned lithium and so on, and the other things, and it tend to, like I knew this one person. He's very, very, very happy going along life, but when he started to see a psychiatrist for problems that he was having, you know, it changed his whole demeanor, his whole outlook. Tend to walk without swinging his arms. Of course, he look a zombie, you know, and people don't like that. So the current medications that are being used are sort of not outdated, but we have to get accustomed to these medications versus taking those medications. Because a lot of reasons why people don't address their mental health is that they do not want to go on these medications.
And there's a stigma attached.
Yeah, there's a stigma attached.
Yeah.
You know?
Yeah,
So,
stigma attached.
so we have to. Yeah, it's a new field. Not that it's a new field. It's a new way of approaching persons, because we now have to consider the mental health. You know, and as I was saying at another program, the persons to actually do the treatment is sort of like you said, the psychologists.
Yeah.
You know, a psychologist is more popular now. You know, you don't want to hear psychiatrists.
Yeah.
You don't want to hear psychiatrists. And we doctors, we can deal with part of it, you know, and we can address it. But persons, for instance, persons want to bare their soul, right, before they bare their clothes. You know, they want to get comfortable with you. As a doctor, person come in my office and I say, okay, go in there and take off your clothes. Look at me. What do you mean? You talking to? You understand? They want to first outline the problem and get comfortable with you, you know, before you can say, okay, let me examine your tummy. You know? So the same thing with psychiatry. You understand? Same thing with mental health. Persons want to establish a relationship with you, explain what problem they're having before you can institute a treatment. Okay? So that's the whole process.
And I think that what people also need to recognize as well, and the two doctors can probably speak to this, is that people with chronic diseases oftentimes get depressed. Because you are limited in what you can eat. You're limited in the activity that you can do, especially if it's a chronic disease which has you bound to your home. So you may not be able to get involved in work activities, or the nature of disease kind of depletes your energy. So you have to stay closer to home, or you may have like intestinal problems that, you know, you may be bound to your home. So that is something that you also need to discuss as well. I wanted to know how much of that have you seen in your practice? Up to today, you heard it on the radio program where the person was so frustrated that they almost mentioned sentiments of they just wish that they can go. So how do you deal with that in your practices?
Yeah, there is definitely a link between the chronic diseases, and this is not just you know, diabetes, hypertension, as you alluded to, chronic pain. Persons dealing with chronic pain, you know, are more likely to have depression than someone who is not. You also see it with diabetes for sure, and sometimes you wonder, you know, and I know some research has looked at which came first, where you have someone who's diagnosed diabetic, and you may think as a physician, but this person can do a little more. They can put in greater effort trying to control their diabetes, and you don't see that. But sometimes it's because there's undiagnosed depression, which has affected their motivation, their drive. They don't have the interest in, you know, they feel flat and looking out for themselves anymore. And of course, that will naturally result in the blood sugar levels becoming much higher and the attendant complications. So yeah, there definitely is a connection there, and you have to address that. It's an area for a lot of psychology and counseling, because if as a primary care physician you just push medication to deal with the diabetes only, and you don't address the fact that the depression is a significant part of why this person is struggling, and you don't address that, you're not going to get very far with diabetes. In fact, quite often the medication will end up at home on the table, not being used, which is why you have to address the whole person, and that's one of the challenges in our health system, public and private. Public more so, where the time to work through these different problems. Sometimes we reduce person to, okay, your blood pressure is this, your blood sugar is that, prescription and gone. And you haven't addressed the fact that the reason why the blood pressure is high or the blood sugar is high is because they aren't taking the medication the way you think they're taking it based on how you wrote it, because of a whole host of problems that they have, and even side effects of medication that as a physician you may not have taken the time to work through, to help them to better manage that. So there are a lot of reasons then why you see the uncontrolled conditions that they do, and mental health is a part of it. The lack of motivation to do more, not always, but sometimes that's due to depression, undiagnosed and untreated.
Yeah, we talk about psychological challenges. Some men, they go through a psychological challenge when they say themselves, you know what, it's about time I get a prostate exam. How do you just soothe that a little bit, and how do you educate the male and say, you know what, this is extremely
important and something we must do. It's so you tell the guys it doesn't last as long as you might think. You can examine the prostate, get all of the information that you need to get, for the vast majority of men, if not all, in comfortably in less than 30 seconds. Once you get the finger in, you can get that in a few seconds. For most, it's once a year they will need to get it done. And I have to let persons know, I tell persons, unfortunately, wishing that a problem doesn't exist or that I am not at risk doesn't make it go away, right? There are many men who unfortunately get prostate problems diagnosed quite late because they didn't want to get the examination, may not have done the blood test either, and you get information from both and refer to urologists for further intervention. And it isn't just with prostate. We do have a challenge with men coming for visits. Quite often their partners have to drag them into the office, and then when there's certain sensitive things that the man wants to discuss, the woman is over there like, so you ain't gonna tell the doctor about So quite often they have to be dragged in and encouraged by their partners to discuss all of their health. That has happened so many times over the years because for whatever reason, and I'm speaking to Barbados, I live here, I've worked in other country, but for whatever reason, I've been in Barbados, many have been uncomfortable over the years going to doctors for what we call routine checks. And when there are specific problems now, so this is not a routine check, you're looking into a problem, delay in going until quite late, until things may be quite advanced. And that is obviously not ideal. Earlier diagnosis, earlier intervention, better outcome. And there are different reasons why, on average, women in Barbados live longer than men, but that is one of them. One of the reasons for sure that men tend to seek medical intervention later on and tend not to get their routine checks as faithfully as women do.
The finger you mentioned is still the most effective. It's still the most effective way of checking for
DRE, digital rectal examination, and PSA screening still advised. That is both. As far as PSA screening, it is not as that will take a little more time to explain the pros and the cons, but the simple short answer at this point is that both are definitely still advised, not one or the other.
What age do you recommend? Things have changed
for most, it will be age 40. If perhaps there's a younger man who has a significant family history, either a father or older brother, so someone on the father's side of his family who was diagnosed with prostate cancer earlier, as can happen, in their 40s, you may drop that to age 35, but generally anywhere between 35 to 40 annually. The benefit I tell guys in PSA screening isn't in the single result by itself, but how your result tracks over time. January 2025, how does that compare with January 26? What kind of increase do you see? You clearly do not want a situation where you're sending every man for a prostate biopsy, or every time you see a PSA just a little over, it's going for a prostate biopsy. So you look at how results track, you look at the information that you get from examination, you look at the person's risk, and you put a profile together and determine who you're going to recommend to the urologist. I tend to err on the side of caution and let that person then have further discussion with the urologist regarding whether they should get biopsy additional testing or not. But 35 to 40, and to get into the habit of doing that annually.
What I mean, men need not to be afraid. At least I take a different approach to the prostate. I usually start with the PSA, okay? And long time ago you had an ultrasound and stuff, but the technology is really nice now. You can lots of people they use a transrectal, they use this same digital is the transrectal examination, but now they can actually go through the abdomen, right? Go surface, and it can give you a nice picture on the texture, the size of the prostate, so they don't need to fear anything, and the gold standard for the prostate is the MRI. But they're expensive, but that's the gold standard. If you get an MRI of a prostate, right, it can tell you whether that prostate has cancer or not straight away, without biopsy, without the digital rectal exam. The MRI, it paints a better picture. You can see more. You can see. Well, that's pretty expensive. But before that, you can get the ultrasound, which is pretty decent, or pretty much a good indicator. You see the urologist for that. So men don't have to be afraid. They can tell you now. You can come and you get your PSA. Now, if that is low, if the PSA is low, pretty much you have nothing to worry about. But if that is high, you don't need to, it's not a death sentence. You can send you for ultrasound and go to the abdomen, and if you have to change in your pocket, you can get an MRI. They can take you up to about $3,000, so right, Dr. Wickham was saying, you should start at 40. Yeah, that's about the age. But you start at 40, you can start with your PSA, because we have had some guys who have been diagnosed with prostate cancer as young as 38 and 39, So you start there. But there's no need to be afraid of that finger. They have these ads in these magazines show a doctor with a finger that big, ready to perform this examination. No need to be afraid of that, and to tell the truth, usually you're going to get late when that finger can tell something. The ultrasound and the MRI can tell me much more. Okay, so what I've been trying to do to advocate the patients, I've been telling men, come let me do a PSA, let's do it. It's unfortunate that what we talked about earlier, sometimes the QH don't have the reagent to do the PSA. That is unfortunate. But it should be readily available, and the privately it's not too expensive. I've seen organizations been doing it for $50,
every month, I think.
Yeah. So for men 40, start with your PSA. Come and get the PSA done. Come and get it. Well, from there we can go a little further. We can either do the ultrasound, or we can do MRI if you got a little change in your pocket. Okay? And that's the way we'll go. Now the why we don't go to the biopsy is that it's we usually do several samples to check and then has to go to the lab and get checked to see if it's cancer. And there have been lots of reported cases where it causes infection because you're going through with a needle, and that passes through
The rectum.
the rectum, and it's going through the rectum, and lots of organisms pass on through there, right? So you have a chance of infection. So you might check in the person for prostate cancer, then they die of sepsis, So what the stage we're at now is safe and painless, and you don't have to be embarrassed. So lots of men, I ain't getting to him. He figures too big.
All right. Well, no, to ease the conversation a little bit. No, I guess that overall, from what we've been discussing tonight, one of the greatest challenges that we face within our healthcare sector is the proper allocation of resources. And I would want to ask a question. The state of Harson's Point at this stage, and it was utilized heavily in COVID, and it is possibly closed now. But when we close buildings in Barbados, and you have to come and use them again, you have the sick building syndrome. And that is one of the ways that we are not effectively utilizing resources, because it should be open at this stage to help to ease some of the burden at the Queen Elizabeth Hospital. As we spoke about tonight, one of the challenges is the primary health care has been failing, and the doctors at the hospital now in accident and emergency have to observe some patients for a longer period of time. That's why there's such a backlog in accident and emergency, and oftentimes not the beds on the wards to get the patients to. So the government needs to properly utilize the resources which they have at their disposal. Similarly, the St. John Polyclinic, when it was built, when it was developed, it was expected that it would have a wider use instead of 8 till 4:30, well, 9 till 4:30, that it would be operating at night. It had the capacity for an ambulance bay. It was also supposed to be built with the X-ray machine so they can do the diagnostic testing there. And that would also help to ease some of the burden off of the Queen Elizabeth Hospital. So we need to get our government to, well, the Democratic Labour Party definitely will do that study to allocate and properly utilize the resources which we already have. But I couldn't end this program tonight without asking a question, because the last time a particular event happened in Barbados, it happened to coincide with COVID. I know this year the event is back again, and we've been hearing news in
to add another question. Is it so far, based on your research, is it as severe, or do you see it becoming a real major pandemic at this? I mean, it's still early to say, but in terms of the symptoms involved, it kind of flu-like, and they got, I think, pneumonia involved, etc., etc. Do you see it as one of these very serious illnesses so far?
So too early to say whether the human metapneumovirus can become a pandemic of this on the scale that COVID did. First thing I would point out is that it's not new. It's been around for over 20 years, and it's been a part of seasonal cold seasons in the northern hemisphere, winter, early spring for 20 plus years. So it's not new. Quite a few persons then, as a result, have already had it and would have antibodies to it, which would give some protection. Obviously, with viruses, there's always the possibility of mutations and additional strains. That's always possible with virus. And if something like that happens, antibody protection from a previous strain may not be as helpful. So that there's always that possibility. But it's not new. It's been around. Many persons already have antibodies to it. Symptoms very similar to what we would call the cold. Runny nose, sneezing, cough, sore throat, possibility of fever. Those are all your typical cold symptoms. As far as complications pretty similar, but in particular groups. So the at-risk groups are very similar for most of these respiratory illness. Children under age 5 and the younger under age 5, higher the risk. Elderly over age 65 or older, greater risk. Persons with conditions that weaken their immune system, and there are a number of those. Persons who also have pre-existing, so already existing lung diseases such as asthma or chronic obstructive lung disease, pulmonary disease called COPD. So these are persons who are at higher risk of complications such as pneumonia. Right? But for the majority of persons, similar to what you may get with a common cold, for the majority of persons, they will do relatively well, and there's symptom treatment. Now, as far as what you can do, there are a number of lessons I think we've learned from the pandemic. Spread is through, with HMPV, spread is through droplet, respiratory droplets, but also close contact, as well as touching contaminated surfaces, and then transferring the organism to your mucous membranes, eyes, nose, mouth, etc. That's spread. And we learned from during the pandemic, persons who may not have known before learned during the pandemic how you can reduce infection. Clean hands, keep your hands away from your face. If you are a high risk individual or you're in higher risk locations, considering masks. At this point, I haven't heard any talk about any mandates and so on, but it's down to individuals' decision based on their risk profile to determine, I'm going to this particular setting, I will consider wearing a mask. 90K, 95, N95 or 94 will be the ones that would offer greater individual protection than surgical masks. But obviously, that's an individual's decision based on their risk profile, but those are the things that you can do along with the hygiene measures to help reduce risk for infection. But at this point, too early from my vantage point to say whether it will become a big global pandemic like COVID did. It's been around for a while. It's not new, so many persons would have already had it and probably didn't even know. Just thought it was a cold.
Well, I definitely want to knock on wood. Hope that this is wood. We've had an extremely robust and insightful conversation here tonight, and I want to thank each and every heartfelt thank you to each and every one of you for coming out, taking the time out, and giving us some insight on health and wellness in all types of areas. Last comment?
I just want to say to Denny that my mom was a beneficiary of the Cuba Health Program. And when she came back, she threw away her glasses. And she's now 80, approaching 81 years old.
Right.
And I can support what you're saying and suggesting.
You need more people in there.
Yes. Dr. Hinds?
Right. Yes, just to follow up on what Andrea was saying, if they close the facility in Parsons Point, eventually we're gonna have just as much trouble reopening it because, as you say, it's sick building syndrome, and this government has a history of doing that. When we lost the government in 1994, the St. Joe's Hospital was up and running, and they destroyed it, and now to get it back where it's at now, to bring it back up to being able to see a patient in it will take millions of dollars. It's almost an impossible task. And, they don't have a vision for healthcare. They don't have any plan for healthcare, and we need to get back in government. We need to execute our plan, because when what Mr. Denny was talking about, we had established a sort of link, because the eye care center at the hospital, we had planned to, coordinate activities, coordinate the professional intelligence you get from Cuba and institute it there.
The Lions Eye Care Center.
Yeah, the Lions Eye Care Center. Now they were the program talking about, test your children vision at a certain age. Every podcast we can test your children vision. They're now catching up. We were about 10, 20 years ago.
1994 prior.
Yeah. So they're not serious about healthcare and about problems. We know that you're supposed to test children's vision at a certain age. We established an eye care center for that. You understand? And we were testing it at the more serious level and more comprehensive program with Cuba and so on. But we need to get back in the government. We need to institute these programs. Okay, that's all I have to say.
Can we give it to Denny?
Okay, we give it a
Right,
no problem.
First, I would like to say that Senator Andrew Worrell that what your party need to do is strong investigation in relation to this home service, because there are a lot of issues and problems there in terms of nutrition. And secondly, I would like to recommend that we look at a stronger community medical system for our people, where we can create the conditions for doctors to practice within the community centers and to help communities with small cases. And finally, I think a new Democratic government should turn all of the polyclinics into small hospitals so that we can carry out simple surgery work there, so we can reduce the list that we have for the QEH and help poor people with medical assistance.
Dr. Wickham?
My final comment for the night to all Barbadians would be to remind us that we all have a role in caring for ourselves. There's definitely a role for government, any government administration, and ensuring that systems are in place to allow persons to get the care that they need. There's also a role for us as individuals. And I will say this as I do in my office. The decisions that we make at any moment about how we are going to treat hypertension, high blood pressure, diabetes, high cholesterol level, we tend quite often to make that decision based on how we feel now. Persons who experience various complications, and if we go to the extreme, heart attack, stroke, which can definitely be fatal, I usually would try to remind clients by way of helping to motivate them to be, to let us work together to help them. I remind clients that those conditions aren't experienced because of what happened the day before, usually, full stop, the day before an exclusion, or how they ate last week, or how they ate last month. The point that I'm making is that these conditions or the situations that give rise to the artery blocking, causing a heart attack or stroke, is usually many years in the making, influenced by decisions made 10 years prior, 15 years prior, how I lived my life then, how things were controlled then or not controlled. So what can happen? You can have a scenario where someone's been well controlled for the last 6 months. Boom, get a heart attack, gone. It can happen. So I encourage persons to, as we feel well, while we feel okay, but we've checked, we've checked, it's confirmed once, twice, 3 times, 10 times, many times, blood pressure is high, blood sugar is high, work with your medical team, doctor, nutritionist, physical exercise expert, and getting the conditions controlled, because what you're doing is you're investing in your future. It's not just, well, I feel good now, so I don't have to worry. Too often I have heard, doctor told me I had a little pressure, I had a little sugar, and I'm seeing this person 15, 20 years later, and they are a moment away from a heart attack or a stroke. Even if things are well controlled now, because of what happened or didn't happen many, many years before. So, yes, there is preventative in terms of trying to avoid diagnosis, but if a diagnosis is there, confirmed diagnosis, taking every effort now to try to bring these conditions under control to either avoid complications, delay complications, or reduce the severity of complications, because that is definitely possible even when a diagnosis. And as we heard, in some cases, you can even get regression to the point where persons can come off medication.
Great. Thank you, Dr. Wickham. And I want to say that we had a very informative show, and I'm seeing comments on the screen from the audience, and this is something that we definitely need to do again, and because we need to give positive information to Barbadians. We can't just highlight the problems, but we also need to give positive information and let people know that you can still work through some of these challenges. And yes, I think also that we've recognized the IMF austerity programs. You hear the government taking credit and boasting about meeting the IMF check marks. But what they're not realizing is that those austerity measures are starving Barbadians of much needed resources, especially in our healthcare sector. So we're
dying.
Yes, and people are dying.
The operation is successful, but the patient is dying.
The patient is dying. And we have a double whammy in that we came out of the COVID lockdown with a number of people being locked away at home, not exercising, not doing the things that they were supposed to do, and the chronic diseases are just building up. And now with the IMF austerity program, they're not able to access the adequate treatment and care in our polyclinics and in our Queen Elizabeth Hospital. We're not utilizing our resources effectively. And these are things that we need to combat as a country so that in 2025, Barbadians should be able to feel more positive and optimistic about, if I have an issue, be it dental, I can go to a healthcare professional and not have to wait 6 months for an appointment. We need to improve on these things, not have to wait a year for surgery. We need to improve on these things, because unless you can feel the confidence that your whatever it is will be treated, you would tend to stay away from the healthcare professionals that can help you. And when you do that, you're only making the situation worse. There's a comment there. Can you please? Oh, yes. And then in ending the show as well, yes, the Democratic Labour Party will be celebrating the Barrow Week of Activities. And those activities start on the 19th of January with a church service at 10 a.m. at the Messiah Wesleyan Messiah House in Messiah Street, St. John, 10 a.m. And we're inviting all of our members and all of the viewers, all the Democratic Labour Party supporters, come out and support our Barrow Day and the activities. Then we will continue with a public meeting, which people have been asking for ever since. We are going to the public. This is being organized by the Young Democrats. So the venue for that, but that will be on Sunday the 19th in the evening. And then we will continue on Monday the 20th with the Barrow Memorial Lecture being given this year by the Leader of the Opposition, the Honorable Ralph Thorne. And the venue for that will be the Barrow Center for Creative Imagination at UWI Cayfield, where we normally go every year for the Barrow Lecture. So that will be on the 20th, Monday the 20th. The next day, Tuesday, being Barrow Day. And we've been invited to North Stars Cricket Ground for a T20 match. So that would be in the afternoon on the 20th from about 1 to 5:30 in the afternoon. But before that, we may have a special treat for you. You will learn more about that as we go on. And then internally for the party members, now we will have a joint meeting for the General Council and the executive members on the Thursday, the 23rd, that should be, and continue the week of activities. But you'll see all of the information, and we just encourage you to come out and support the Democratic Labour Party. We are ready, as Mr. Denny has been saying, to take on the government and to bring relief to Barbadians, not only in healthcare, but in education and tackling the high cost of living, because the government seemed quite happy to collect more and more taxes from us while we suffer as a people and not being able to afford the healthy food that would make our lives better. So I want to say that, especially for Ms. Salmon as well, we had a lovely show and we will repeat it again.
It was really, really lovely. I must say, really, really lovely. Yes.
Very
And also for my final comments, I believe that healthcare should be paramount. Right? Should be high priority. You know, we find funds to pave roads that are already paved. You know,
dig them
but
up,
dig them
mash
up.
them up, and then pave
Of
them
course,
again.
there are some that is well paved, right? Already well paved,
Mhm.
right? We find money to do all types of things, but healthcare should be paramount, right? And I just want to end on that.
Thank you.
Yes. And again, I want to thank you, gentlemen, for taking the time out to come in and sharing word.
And Ms. Salmon.
And Miss Salmon as well, too. Right? And I want to thank you, gentlemen. And this is DLP TV. Signing out. Good night.